Hello and welcome, guys. In today's this session on ear, okay, the anatomy of the ear. We're gonna understand the anatomy of the ear in a very simplified manner, and this will gonna be a very important topic if you are targeting NEET PG, INICT, and all such exams, and also for an anatomy first year examinations, as well as your ENT part. If you are studying starting off with ENT, then the understanding of the ear and the anatomy of the ear is very very important. You must know the nerve supplies, you must know the blood supplies, and you must know all the things associated with that, right? So before starting ENT, do watch this lecture because it will wanna pave a path for you to make up the concepts, make up the disorders step by step, right? Okay. So ear looks very simple, but it is a complex organ. Okay, it is a complex organ. I will admit it. The nerve supplies are all different. On the basis of areas, the middle ear is basically a meshwork of structures. Okay, we'll see a very simplified diagram which you understand very easily. I'm sure. Okay, let's first go into a gross structure of the ear. Then we'll go into step by step. And then we'll go step by step into external ear, middle ear, and internal ear. Internal ear is not a part of anatomy, I believe, because you read it in physio also. I will give you a basic detailing of that. Just that is enough, right? So let's start with a diagram of the ear. I'm bringing a diagram of the ear, and then only we move forward, right? So let's start with the diagram first. Okay, so on your screen is a diagram of the human ear, and you can see it is divided into an outer ear, middle ear, and inner ear. Okay, so this part is the outer ear, this is the middle ear, and this is the inner ear. If you can see, the outer ear has a helical part, the helix, right, and an anti-helix which is running in a loop. You can, if you can appreciate the helix here, you can also appreciate the anti-helix which is going down. Okay, it is difficult to show you, but if you can feel, you can just note helix is going upwards, anti-helix is going down, right? Okay, not much important. Helix, you know, and this ear lobe is called as the auricle. Okay, this is a structure of fat, and auricular lobule and ear lobe. Okay, then you have an external auditory meatus. This is the external auditory meatus, also known as the ear canal. And here you can see the eardrum, that is the tympanic membrane. And this tympanic membrane basically makes an angle of 55 degree. It's basically making an angle of, just a minute. This is making an angle of 55 degree with the floor of the meatus. Okay, this is the floor of the meatus, and this is the tympanic membrane. So you can very well observe that it is making it angle of 55 degree, right? Okay, you can see here three bones. This is the malleus, this is the incus, and this is the stips. Okay, this is the stirrups. Stirrups has you can, if you can trace the this red pointer, you can observe the stirrup is like this. This is the incus. Okay, this whole part, and this is the malleus. So malleus is a lateral handle of malleus, you can say. Okay, this lateral part of malleus is basically attaching to the tympanic membrane. If you will see the diagram of the tympanic membrane, we will draw the malleus here, right? Attachment of the tympanic membrane and the malleus, and the lateral part is basically attaching. This is the lateral part which is basically attaching to it, right? Okay. Here you can see some semicircular canals are there. The semicircular canals are arranged perpendicularly to each other, and we have saccule, atricle, and all such things, but we are focusing on cochlea. This cochlea is a snail like structure. The turns are there. Okay, endolimb, perilimb, we all know that. The organ of Cottai, you all know that from your basic understanding. Okay, I'm not going into much detailings. And here you can see the vestibular nerve and the cochlear nerve. Together it is called as the vestibulocochlear nerve. It is a cranial nerve, right? And which number cranial nerve, do comment. Okay. And here you can see we have an eustachian tube. Eustachian tube is the opening. Eustachian tube is the opening of ear into the pharynx. Opening of ear into the pharynx. So ear opens to pharynx via the eustachian tube. Eustachian tube or auditory tube, right? And tympanic membrane, I told you, tympanic cavity is there. Some cartilaginous structures are there. Cartilages are basically making the ear, right? Okay. Malleus and stapes, I told. Done. So we observed the basic anatomy of the ear. Okay. This malleus and stapes are called what? Ear ossicles. ear ossicles. Okay. If you all know that, then let's move ahead and discuss about the external ear. So if I try to draw an external ear like this, I will draw it like this, and this is the auditory canal. This is a very simplified diagram of the external ear, and the external ear has a lateral surface and a medial surface, right? A lateral surface is there, you can see lateral surface, and here a medial surface. This back side is a medial surface. So lateral surface is there, and I am drawing it dotted. This is the medial surface, lateral surface, and the medial surface. And what is this? What is this? Auricle. And this is the auditory meatus. The auditory canal is going inside, right? So this is the area surrounding the auditory meatus, right? So here we have some structures which you have to know. Okay. So the lateral surface and medial surface. This is the upper two-third, right? Upper two-third. This is the two-third part. And this is the one-third part. Right. So this lateral surface is supplied by what is called as the auriculotemporal nerve, ATN. This lateral surface is basically supplied by auriculotemporal nerve, ATN. This is also the V3 nerve. Right. Auriculotemporal nerve. This medial surface is supplied by a lesser occipital nerve. Lesser occipital nerve. Okay. So upper two-third is done, right? And the one-third, the lower one-third, which is the auricle part, basically, is supplied by the great auricular nerve. Great auricular nerve, GAN. Okay. So if you understood this, we'll move forward. And these are the nerve supplies. And if I talk about the blood supply, then two this arteries are important. One is the superficial temporal artery. Superficial temporal artery, posterior auricular artery. Okay. So this is the arterial supply basically. So I discussed with you the nervous supply and the articular supply, right? Outer ear is done. Okay, done for us. For anatomy point of view, this much is done. Okay. Let's move on to another important part, which is the tympanic membrane. Tympanic membrane. Tympanic membrane. So what is the shape and size? It is an oval structure. What is the angle it is making with the floor of the external auditory meatus? 55-degree. I told you this, right? If I try to draw a structure of this, let's take a pencil and try to draw. Let's say we are looking for the lateral view, right? So this is, it is three layered basically. Three layers are there. This is the first layer. Let me mark it. One. Okay, let me draw it first, then I will mark it. This is the second fibrous layer, bit fibrous, you can draw it. And a ring is there basically here. This. Okay. And an inner layer. Here's the inner layer. Okay, this is the tympanic membrane. Okay, this is the tympanic membrane. And then an indentation is there. I will mark all the things. Don't worry. Okay. So the first layer is called as the cuticular layer. This first layer, one, is the cuticular layer. Okay, it is made up of stratified squamous epithelium. The middle layer is also called as the fibrous layer. And these rings are called as the fibrocartilaginous ring. I am writing FCR. Fibrocartilaginous rings, right? And here, this indentation part is called as the umbo. Umbo is basically depression which is formed due to the lateral process of the this is the lateral process of the handle of the malleus. This here is the attachment point of handle of malleus. Handle of malleus. Okay. If this is clear, okay. Third layer. Third layer I didn't mark. Third layer is called as the mucus layer. Okay, it is the mucus layer and it is made up of columnar epithelium. Mucus layer. Mucus layer. Done. And I didn't write some things. Let me complete it. So cuticular layer I told you is made up of stratified squamous epithelium. Fibrous layer, of course, fibrous tissue. No such rocket science. And mucus layer, low columnar epithelium. Okay, this much is done. Okay. Okay. So if I talk about this fibrocartilaginous rings a bit, you need to know that there are two types of fibers. I'm drawing this ring only. If I draw this ring, I have some fibers like this. These are called as the outer circular fibers. These are called as the outer circular, inner circular fibers. Inner circular fibers. And outside it, radiating, some fibers are radiating like this. These are the outer radiating fibers. Outer radiating fibers, right? The radiating fibers. So if this part is clear, we'll move forward and we'll discuss about the tympanic membrane. We'll draw the structure of the tympanic membrane and understand how the tympanic membrane is arranged basically. Okay, let me move on and talk about some more about the tympanic membrane. Okay, so if I talk about the tympanic membrane in here, I will draw it like this. This, no, we'll keep it simple. Okay, draw it like this and here like this. Okay, you just make it in this direction. It will be anatomically correct. And if you want, you can shade it. You can shade it yellow, or you can shade it some blue. This is only to differentiate the parts. Okay, no fancy thing. Okay, and here you will see a cone of light basically. You will see a cone of light. Light. Okay, if you just put a fundoscope, sorry, not fundoscope, if you just put that instrument to visualize the ear, right, and the syringoscope and so on, and see the things, then a cone of light will be there. Okay, in your tympanic membrane imaging modalities, if that is there, then in the anterior inferior quadrant, okay, in the anterior inferior quadrant, a light will be there, a light cone of light will be there, and this cone of light is called basically your uh, you can see the cone of light only. Okay, the umbo is a bit upper part. Okay, this cone of light is bit downwards. Okay, so you can call this cone of light only. I will show you a realistic diagram so that you will understand. Don't worry for now. Okay, let me label it first. Let me label it. You're getting confused. Okay, so tympanic membrane, just know that there are two parts, one and two. Okay, two parts. This part is called the pars flaccida. Pars flaccida. This part is called the pars tensa. Pars flaccida and pars tensa, right? And here this green part, let me write it in green, right? This part, this ligament, okay, this is the anterior malleolar fold. Anterior malleolar fold, and this part is the Can you guess? Yes. Posterior. Very simple, right? Malleolar fold. Anterior malleolar fold, posterior malleolar fold. And this is the hammer. Hammer of which bone? You got confused, right? It's not, it is the hammer. Okay. Which bone is the hammer? Hammer and wheel stirrups. You all know that, right? So this is the malleus. So here we have the lateral process of malleus. This is the lateral process of malleus. This part, lateral process. And this part, okay, this is the handle of malleus. Handle. And here indentation is found, right, due to this pulling of the malleus. So this indentation basically is called as the umbo. I told you here also umbo. We drew it here also. And this, because of this pulling only, a in this direction depression is found, which is the umbo. Okay, and this is the light, the cone of light. Okay, so if this is there, then you are good to go. Let me first show you a diagram, a realistic diagram. Okay. Can you see tympanic membrane? So just a circle, no fancy thing. I told you the upper part, pars flaccida. This part, of course, it will be not be visible as clear as this. Okay, but it is visible. This part is the umbo, the indentation, and here you can see the cone of light. This is the cone of light. The cone of light which we are being able to be visible. And this was the malleus. Okay, this is the manubrium, or you can say the handle, simply a handle. And incus can be seen as a faint shadow. This is the posterior fold, and this must be the anterior fold, the posterior malleolar fold, and the anterior malleolar fold. Okay, and you can see the umbo, and this structure is basically an annular structure, right? So this is called as the annulus, and this all part is the pars tensa. Okay, so I told you two parts are there. One is the pars flaccida. This part is the pars flaccida, and this whole part is the pars tensa. So which part is more? There's pars flaccida. Your pars tensa is more than pars flaccida. Okay, the contribution of pars tensa is more than the pars flaccida, right? So if these things are clear, then we can see a other diagram also, the same thing, but we can appreciate more. Okay, if this diagram is done. Okay, let me bring you an other diagram. Okay, so this diagram is straight from your Gray's Anatomy Atlas, right? So you can see a very clarified version of this ear. Okay, as if you are just going inside the ear and exploring the things. Okay, but whatever you say, I can teach you by these diagrams also. You will understand, no doubt. But these diagrams are important so that you can reproduce the things in your exam. Okay, and you can get a very simplified version of that. Okay, if you just look at your body, then very complex things are there. But if these diagrams are there in a hand, okay, then nobody can defeat you. You can just draw and make the person understand the basic thing. Okay, you just need the basic thing. You just don't need to go into many more concepts which are there. Okay, the anatomy is like a ocean, right? So you just need, say, glass of water from that. That is enough for future understanding, right? So these things is there. You can see right tympanic membrane, the anterior malleolar fold, the posterior malleolar fold, pars flaccida. You can just appreciate it. Handle of malleus. This diagram is very accurate, which I drew that time. This is the umbo. Okay, this is the cone of light. It's the cone of light, and this part is the pars tensa part, and this is the annulus. This must be the annulus. Okay, this must be the annulus and the lateral process, and these all things are there. And if this right tympanic membrane, if this is removed, okay, this is removed, so this part is removed, so we are peeping into the inner ear. Okay, uh, sorry, not inner ear, middle ear. Right? Okay, so here you can see the structures of the middle ear. Here you can see the structures of the middle ear. Right? Uh, okay. Here you can, what you can observe is that the nervous structure. Okay, so this is the malleus. This is the malleus. Just okay. This here you are at the tympanic membrane. Let's assume this hand is the tympanic membrane. Here is the middle ear opening. Tympanic membrane is covering it, right? You removed the tympanic membrane. Then you had the bone. Which bone is there? Malleus, because the shadow of malleus was visible, right? So after removing the tympanic membrane, only you can see the malleus, right? Okay, so malleus is there. So in front of the tympanic membrane, you can say from the inner view, from this view, malleus will be like this, and tympanic membrane will be like this, like this. So the nerve that is traveling, okay, besides the malleus and in front of the in front of the middle ear. Okay, if you can just appreciate here, this nerve, this is a chorda tympani nerve. Chorda tympani nerve. So there will be the seventh nerve that will be going here. The facial nerve must be going here. It is a branch of the facial nerve. You all know that, the chorda tympani. So the chorda tympani nerve is basically supplying. Okay, chorda tympani. So it is basically giving innervation to the pars flaccida part also. Giving innervation to the pars flaccida part also. So this is the nerve supply. I told you that it is the chorda tympani nerve. Okay, chorda tympani nerve. Arterial supply. The outer supply, the outer surface is given by a deep auricular nerve, and inner surface by deep auricular artery. Right. Inner surface by anterior tympanic artery, deep auricular artery, and anterior tympanic artery. Okay. So if I talk about the arterial supply of the tympanic cavity, let's talk about the arterial supply. So here you have outer surface and the inner surface. Right. Outer surface, I told you, is given, the innervation is given by deep auricular artery. Deep auricular artery, which is a branch of external carotid artery. The external carotid artery will divide into the first part of maxillary artery. From the first part of maxillary artery, this deep auricular artery basically arises, right? And this inner surface is given by anterior tympanic artery. Anterior tympanic. Okay. So this anterior tympanic artery is basically giving innervation to the inner surface, and plus posterior. Anterior tympanic artery is the major one, plus posterior tympanic branch also. Plus posterior tympanic branch also. And this is also a part of your first part of maxillary. This anterior tympanic artery basically is coming from a first part of maxillary. First part of maxillary artery. And this posterior tympanic branch is a branch of your stylomandibular artery. Sorry, stylomastoid. Stylomastoid artery. Stylomastoid artery, you all know, the posterior auricular artery gives a branch, stylomastoid artery, and is giving a posterior tympanic branch. Right? Okay. This is the arterial supply. What about the venous drainage? Venous drainage is given by external jugular vein and transverse sinus. Outer surface, this, if you are not confused, then I will write the venous drainage also, arterial supply plus venous drainage. So This was your arterial supply. Writing A. And if I talk about the venous drainage, this outer surface is drained by external jugular vein. External jugular vein. And this is given drained by transverse sinus. Okay. External jugular vein and transverse sinus. Okay. And lymphatic drainage, just remember preauricular and retropharyngeal lymph nodes. Lymphatic drainage, if you want to know, much that important, not that important. Just if you want to write, then you can write preauricular and retropharyngeal group of lymph nodes. Pharyngeal lymph nodes. So this we discussed some theoretical part of this thing, and okay, nervous innervations, right? I talked about the chorda tympani nerve. Okay, chorda tympani nerve I talked about, but it is not the you know the proper nerve drainage. I told you just that this chorda tympani nerve, you can trace this chorda tympani nerve is basically going beneath it. Is basically going beneath it. But if you want to know the proper thing of the proper you can say nerve supply of the tympanic membrane. Okay, so this you can divide it like this. Okay, divide it like this. This is the this is the posterior superior quadrant, and here is the posterior superior quadrant, and this is the anterior inferior quadrant. This posterior superior quadrant is drained by auricular branch of 10th nerve. Auricular branch of 10th nerve. This anterior inferior quadrant is drained by auriculotemporal nerve. Auriculotemporal, right? And if you want to like incise the tympanic membrane, okay, if you want to put a incision here, just a minute. Okay, I was telling that if you want to put an incision here, you put an incision here. If you incise the tympanic membrane, okay, then you have to be careful about this chorda tympani nerve which is running behind it. Okay, the chorda tympani nerve is cut, then you will read in the facial nerve what are the different features of what are the manifestations. They're very interesting. I'm not going to that detail, but if you are just incising the uh, this tympanic membrane, be careful about the chorda tympani nerve. And this type of incision, the technique is called the myringotomy. The various reasons are, these things, and it is mostly given in the lower part. Basically, it's mostly done the lower part of tympani, right? So myringotomy incisions are given. If you want to just see the incisions, then you can just look at this diagram. So if there is a fluid buildup in the middle here, let's say here you had a fluid buildup. Okay, here you had some fluid which you have to drain. Okay, then you have to incise the tympanic membrane and drain out the fluid. Okay, you have to incise the tympanic membrane and drain out the fluid, right? So for giving an incision, you have to choose the lower part. So this is the tympanic membrane basically. You all know the parts now, and this is the pars flaccida, this is the pars tensa. Okay, here you will put an incision. This incision is put, and by a scalpel, this incision is put, and the fluid is being you can put a tube here. Okay, you can use the forceps and put a tube here, and this tube is in place, and now you can connect the tube and drain the fluid, right? Connect the tube and drain the fluid. So this was a basic thing about the meningotomy, right? So that's all in today's lecture. And in the second part of here, this was lecture one. And the second part of here, do comment if you want the second part of here as well. So in the second part, we'll move forwards by talking about the ear ossicles. Right? Here is a big topic. So we'll talk about the ear ossicles in the next lecture. Right? So in the let's meet again in the next lecture, and here we'll talk about the ear ossicles, right? So till then, bye bye and take care, and do subscribe the channel. If you want to reach to me, then you can just in Instagram, then you can just take, okay, you can just reach to me here and ask your doubts if there are any, right? Thank you and have a good day. Bye bye. Take care.